Endoscopy is a minimally invasive medical procedure that allows doctors to examine the internal organs and structures of the body using an instrument called an endoscope. The endoscope is a long, flexible tube with a light and a camera attached to it, which can be inserted into various body openings or small incisions. During an endoscopy, the patient is typically given anesthesia or sedation to ensure comfort throughout the procedure. The endoscope is carefully inserted into the body through the mouth, anus, urethra, or a small incision, depending on the area being examined. As it moves through the body, the camera on the endoscope captures real-time images, which are displayed on a monitor for the doctor to see. Endoscopy is used for diagnostic purposes, as well as for certain therapeutic interventions. It allows doctors to visualize and assess the condition of organs such as the gastrointestinal tract, respiratory system, urinary system, and reproductive organs. Common types of endoscopy include gastroscopy. The endoscope is passed through the mouth to examine the esophagus, stomach, and upper part of the small intestine. Colonoscopy. The endoscope is inserted through the anus to examine the rectum and the entire colon. Bronchoscopy. The endoscope is guided through the mouth or nose into the airways to examine the lungs and respiratory passages. Cystoscopy. The endoscope is inserted through the urethra to visualize the bladder and urinary tract. Hysteroscopy. The endoscope is placed through the vagina to examine the uterus and diagnose or treat certain gynecological conditions. During the endoscopic procedure, the doctor may also take tissue samples, biopsy, or perform interventions such as removing polyps, cauterizing bleeding vessels, or placing stents. Endoscopy offers several advantages over traditional open surgeries, including shorter recovery times, reduced risk of complications, and minimal scarring. However, as with any medical procedure, there are potential risks involved, such as bleeding, infection, or adverse reactions to anesthesia. It's important to note that while I can provide general information about endoscopy, specific details and protocols may vary depending on the purpose of the procedure, the individual patient's condition, and the preferences of the healthcare provider. Always consult a qualified medical professional for personalized advice and information related to your specific situation. Send a message. Free research preview. ChatGPT may produce inaccurate information about people, places, or facts. ChatGPT May 24th version.